Here is the current HHS Region 4 Special Pathogens SITREP. First, some positive news. On the 13th of March, Tanzania officially declared the end of the Marburg virus disease outbreak after recording no new cases over 42 days since the death of the last confirmed case on the 20th of January this year. The outbreak, with 2 confirmed and 8 probable, carried a 100% case fatality rate and was the second the country had experienced. With support from WHO, Tanzania improved its preparedness capabilities in training and surveillance. Next, neighboring Uganda continues to experience an Ebola Sudan virus outbreak with the discovery of new unlinked transmission clusters. The outbreak was originally declared on the 30th of January after the index case traveled from Mbale to the capital Kampala, and by February 18th, the remaining hospitalized patients had been discharged, leaving the case fatality rate at 11.1%. However, earlier this month, on the 5th of March, an infant who died was found to have Sudan virus, and further investigation revealed close family members had died in February of unknown illnesses, likely probable cases, and without links to the original cluster from the western regions of the country. Additional contacts have been reported who are symptomatic, and concern for undetected transmission remains high, given the porous borders and political instability in the region. Also in Uganda, on the 14th of March, the Ministry of Health confirmed an outbreak of Crimean Congo hemorrhagic fever in the district of Kigegwa, where there currently is at least 1 confirmed case with several suspect cases in isolation units. We are entering the peak season of CCHF in the Northern Hemisphere, which is typically April through October. Next to Nigeria, where the Lassa fever virus outbreak continues to decline in parallel with historic seasonal trends. Most of the country is entering the rainy season now when we see decreased spread, though vigilance in the U.S. is still paramount. As of the most recent official report released by the Nigeria Center for Disease Control and Prevention on the 9th of March, there have now been 2,960 suspect, 563 confirmed, and 103 deaths this year, a case fatality rate of 18.3%, which is similar to prior years. Young people ages 21 to 30 continue to be the most heavily affected demographic, and in positive news, no new healthcare worker infections have been reported in the past several weeks. Now eastward to India, where in the state of Karnataka, Kayasanar forest disease, or KFD, has been confirmed the cause of death in a human, a first for this year. In 2025 thus far, there have been 95 confirmed cases, and last year there were 13 confirmed deaths in total. And in neighboring Bangladesh, the Institute of Epidemiology, Disease Control and Research reported earlier this month that the 3 confirmed cases of Nipah virus this year have unfortunately died, a 100% case fatality rate. Patients infected with Nipah from the consumption of raw date palm sap contaminated by bat saliva typically show symptoms earlier than most viral hemorrhagic fevers, usually within 5 to 7 days of exposure, and severe cases almost uniformly display encephalitis. There are no known effective medical countermeasures. And lastly, in our busy month to highly pathogenic avian influenza, or H5N1, since our last SITREP, there have been 2 additional confirmed cases in our country, bringing the national total to 70, with at least 7 cases pending confirmation in 17 states. At this time, there are no known critically ill patients, though testing continues to lag behind clinical needs. Importantly, there is still no evidence of person-to-person transmission, but more poultry outbreaks have been confirmed in 4 new states this week. And globally, Cambodia reported another pediatric case of H5N1 in a young child with exposure to sick poultry, raising the country's total this year to 3, with 2 pediatric deaths. And separately, the UK Health Security Agency on the 24th of March confirmed an H5N1 outbreak during routine surveillance testing in sheep at first. And finally, there have been no reports of suspect or confirmed patients with special pathogens of concern in Region 4 at this time. For more resources, visit us on our new website at scdp.emory.edu.